Welcome back to the channel, everyone. If you're experiencing a weak urine stream, well, you're in the right place. I'm going to teach you how to figure out what's causing this decreased power and how to fix it so that you can increase your flow and spend less time standing in front of the urinal. If you're new here, my name is Eric. I'm a mental health physiotherapist, and this channel is dedicated to mental health physiotherapy and helping you to overcome mental health issues. I post new videos every single week, so make sure you subscribe to my channel by clicking the subscribe button below and join our growing community. Okay, so you're standing in front of the toilet and you just don't seem to have the same strength in your flow as you once used to. Not only is this going to result in you spending more time in the bathroom urinating, but a weak stream can also lead you to not emptying your bladder fully, and it can even result in urine dribble after you zip up your pants. And here's the thing, decreased flow can affect guys of all ages, but the good news is that there's lots you can do to fix this issue. Let's start off by what might be causing your decreased flow. Is it a bladder obstruction or is it a tubing obstruction? Do you have an infection that's causing inflammation surrounding your P-tube, blocking your flow? Well, you can't really be sure until you schedule an appointment with your doctor to have a few simple tests completed. This is such an important first step because you want to know exactly what's going on so that you can fix the issue faster. And for some men, it might be that you're taking a certain type of medication that has a side effect which paralyzes your bladder. Or you might have an enlarged prostate, which is obstructing the tubing, leading to a decreased flow. Let's dive into the diagnosis of an enlarged prostate causing your decreased flow symptoms, because statistically speaking, for most men, an enlarged prostate is going to be the root problem. And let me be clear, just because you have an enlarged prostate does not mean that you have prostate cancer. These issues are completely different from one another. An enlarged prostate can happen to all men, but most commonly it happens to men over the age of 40. You see, your prostate is a gland that is responsible for producing semen, and the prostate itself actually wraps itself around the P-tube. Now, when your prostate starts to grow abnormally, this will constrict the P-tube, leading you to decreased urine flow and decreased strength of your flow. Now, some doctors will tell you that having an enlarged prostate and resulting decreased flow will happen naturally as you age. However, there is recent research that tells us that it might be connected to what we eat and drink, and that by applying simple lifestyle changes, you can actually shrink your prostate and increase the strength of your urine flow. Let's start by modifying your bathroom technique. When you're experiencing decreased flow, I always recommend sitting down when urinating. Yes, I know, most guys like to stand. However, when your flow isn't as powerful as it once was, sitting down to urinate will help you relax the muscles surrounding your abdomen and your pelvis, which will help you empty your bladder more completely. So sit down to pee, completely relax into that position, and focus on getting all the urine out of your bladder. Now, before you go to stand up and finish your business, I recommend performing a few Kegel squeezes while sitting on the toilet. This ensures that you are clearing the line of any remaining urine so that you don't have to deal with any urine leakage when you stand up and zip up your pants. If you're unsure of how to complete a Kegel squeeze, also known as a pelvic floor contraction, I'll link my video covering this topic above and in the description below for you to go check out. Alright, next you want to avoid certain foods with an enlarged prostate because these foods will make your flow issues worse. And by changing your dietary habits, you'll actually see an improvement in your symptoms relatively quickly. Let's start off with starch. So starch is found in food products such as white bread, pastas, and rice. Now the issue with starch is that it's classified as a high glycemic food, making your enlarged prostate symptoms much worse. And I know we all love a nice bowl of pasta, however, it might be best to reduce your consumption of these foods until you can get your flow issues better managed. Moving right on to red meat. Red meat has been found to have high levels of HCAs, which stand for heterocyclic amines. And these HCAs develop when red meat is cooked at high temperatures, which contribute to enlarged prostate issues. Now, consider swapping out your red meat for maybe lean poultry or lean fish options to mix up your meals when sorting out your enlarged prostate issues. Fatty foods is another category that you'll want to keep your eye on as they contain high sodium levels, which will definitely make your flow issues worse. The next categories we're going to discuss are big ones, and if you moderate the amount you consume, I can guarantee you will see almost an immediate improvement in your symptoms. Up first is caffeine. Now, caffeine doesn't directly impact the growth of your enlarged prostate or cause an obstruction of your flow, but caffeine is a diuretic. And this means that when you consume caffeine, it will actually make you want to urinate more frequently. And if you're already experiencing decreased flow and incomplete bladder emptying issues, well, needing to urinate more often is only going to amplify these problems. Caffeine is definitely something you'll want to limit with an enlarged prostate. Heavily caffeinated products can be coffees, certain teas, and soft drinks. So do yourself a favor and try your best to avoid caffeine. Lastly, we need to discuss alcohol. Most of us will enjoy a nice glass of wine with dinner, or maybe a cold beer after a long day. The issue with alcohol is that when consumed, it relaxes your bladder, leading to more frequent bathroom trips, making your decreased flow issues worse. Alcohol also directly increases your prolactin levels, which causes increased prostate growth. So as you can imagine, if you're already experiencing enlarged prostate issues, drinking more alcohol is definitely going to increase the severity of your symptoms. I would recommend that you consider non-alcoholic beers or maybe even just giving up alcohol altogether until you sort out your flow issues once and for all. Alright, now that we've covered a few dietary modifications you can make, we need to discuss physically training your bladder and your pelvis muscles to help increase the strength of your urine flow. Your pelvic floor muscles are located deep within the pelvis, and these muscles work to support the bladder and they directly help you with your urine flow. So naturally, by strengthening up your pelvic floor muscles, you'll be able to see an increase in the strength of your flow, you'll be able to empty your bladder entirely, and you'll also ensure that you are completely clearing the line of all urine after urinating. I recommend learning how to do Kegel contractions for the strengthening of your pelvic floor muscles. Now, I've made a video teaching you how to properly perform a Kegel's contraction, and I'll link it above and below in the description for you to check out. Now, if the above doesn't work for you, head back to your doctor as they will be able to recommend different medications or procedures to help you improve the strength of your flow. And that's going to wrap up today's video. I want you to try out those tips mentioned in the video and get on top of your flow issues. This is not a condition that you should have to put up with, and as I've already explained, there's so much you can do to fix it. I hope you enjoyed the video, and if you haven't done so already, please click the like button and subscribe to the channel. Also, feel free to drop me a comment below if you have any questions, and remember, regardless of your situation, keep going, and I'll see you in the next video.